Welcome back. CABS Healthcare Network is a nonprofit organization pioneering a transformative approach to home care services and community outreach. With over 40 years of excellence in promoting well-being, CABS is dedicated to fostering community development. Joining us is the Chief Executive Officer of CABS Health Network, Sherly Demosthenes-Atkinson. Sherly, thank you so much for joining me.
Thank you, Kibin. It's a pleasure to be here with you.
Now, can you provide an overview of CABS Healthcare Network's mission and the core principles that have guided your organization for over 40 years?
Sure. It's a pleasure to talk about CABS every chance I get. CABS is a not-for-profit healthcare health network that offers a wide range of services across New York City and Nassau County. It started in Brooklyn over 50 years ago when the late Congresswoman Shirley Chisholm broke ground on CABS nursing home and supported various CABS programs, including credit union and senior living facilities, which we're still using today as a legacy as a result of Shirley Chisholm. So currently, CABS support home care services for the elderly and the disabled with activity of daily living with a workforce of over 1,000 caregivers. CABS remains one of the largest employers in Bedford-Stuyvesant, Williamsburg area. Should I continue?
Oh, of course, yes.
Okay, so among the various services that CABS provide is care management. And care management, if someone thinks about it, it's not a building or a place, but rather CABS has this program that provides a specialty trained care manager who helps members better understand all of their physical, mental health, and social service needs, and then creates a comprehensive plan of care that is designed to link members to healthcare providers, programs, and other community service that meet the identified needs of our patients or members that we onboard. Because that service not only service our existing clients, but also the community at large. So this is also a way for us to circle around, to circle the care or wrap the care around the community, finding any gaps in the services that we are providing and make sure that we fill in the gaps wherever the clients might need social service support, home care, or care management. So we have a way of wrapping the circle of care around them.
Now, can you share more details about CAB's Medicaid Together program and its impact on improving youth asthma outcomes in the Brownsville neighborhood of Brooklyn?
Oh, sure. Actually, we cover a wide range of pediatric asthma throughout New York City. That program pretty much keeps children from being hospitalized from asthma. So, how we help them is through our asthma program, where we dispatch pest management as allergens that may cause their hospitalization. So we're connected throughout New York City, where it helps reduce children from not going to school or having any kind of exacerbation as a result of allergens. CABS is able to dispatch pest management and reduce hospitalization for those children, but also create a healthy home, not only for them, but also for the entire family.
And I think you may have mentioned it, but this is part of a city-wide effort. I understand that you work or collaborate with the Department of Health. Can you just expand on that a little bit more?
Oh, sure. We actually started this program, I would say about 7 years ago, which was on a larger scale under district. And we were one of the success stories working with Kings County among other outside providers who referred a lot of the patients that they have identified, meaning children, because this focused on pediatric children, but it also involved the parents. So we were able to decrease a lot of the hospitalization under that project because of our success in that program. The state partnered with us, and now we're able to actually curate how we assess any kind of issues when we receive referrals from different hospitals throughout New York City, Presbyterian Hospital, Lincoln. Many of the hospitals are in partnership with us, collaborating for when they do encounter any hospitalization from children. Those children are referred to us to conduct an assessment.
Now, given the history of the organization, I can imagine one of your next efforts is super important. And that's basically, how does your organization ensure that healthcare services are accessible and equitable for all members of the community, particularly those who face social or economic disparities?
Well, that's always in the forefront for us. Our mission started to focus on the needs of the underserved. And that was the reason why CABS was created in Bed-Stuy, because in the late 60s, it's so unfortunate, but the Black and Brown residents in Bed-Stuy were not being served. So we're always thinking about ways of addressing the need of the underserved population. Although we cover the entire community with throughout New York City, but our focus is always on the underserved population and hire individuals in the community to service the community or the catchment areas that we have. So um, uh, um, you know, social service access, healthcare access, healthcare equity has always been a core value for CABS, and it's also a tenet within our mission is to ensure that we always address the social needs of the underserved population.
Now you mentioned that it was about 60 years, or it dates back 60, to the 60s, and I'm sure
Mm-hmm.
nationally it's even further. Why is it so important that we still, have these services available for these underserved communities? I think sometimes people may not understand. So you can just explain why it's important that these services still remain.
It's important to one provide the education, and I think having your program to talk about that is for underserved population to have access, know that these types of services exist, because it's very difficult for them to navigate the type of services that they need, and not wait on a crisis, which sometimes they find themselves in a hospital setting. And that's really what the state does try to curtail is not having individuals being serviced in the hospital because it's more costly. So it's really important for us to always be available, be a resource for the community, and to let them know that this service is available for them.
Now, I want to highlight, the time during COVID. Many organizations, including, your organization, have stepped up to support those in need. Can you just talk about some of the strategies your organization implemented to ensure that everyone received the care they needed during the pandemic, and especially, for so many communities in New York that were underserved? It was a really big challenge. So can you just talk about how your organization kind of went through that?
Um, the COVID-19 pandemic was challenging for us, just like everyone else in the world. It was a war on humanity. We knew we had to fulfill our mission to take care of the most vulnerable New Yorkers, no matter what. Our caregivers went to their clients daily. Our staff showed up to the office daily because we know these vulnerable New Yorkers depend on us to survive. We didn't have a choice. COVID or no COVID, we had to be available for our vulnerable population in New York. If anything, one of the good things that came out of COVID for us, we were able to enhance our technology to stay open, to have communication with our nurses, with our clients, and also our partners. So we never closed our doors during COVID. I actually went and delivered PPE for our to our home care workers and clients. So we did not falter. We went out and did exactly what was expected of us, was to service the vulnerable population. Although we did not receive the gifts, we were not highlighted in the news in terms of home care, but we were the organizations receiving clients who were being discharged at the hospital. So, like I said, our mission remained our guiding light during COVID, and we did what was expected of us. We service the most vulnerable population during COVID.
Now you talked about not being highlighted, by, the major organizations, but I understand that your organization does do, some acts where you highlight and celebrate, the people within the community. I understand there's a Circle of Cares Awards. Can you just tell me a little bit more about that? And, who are you celebrating when you have those types of events?
Well, part of our circle of care is, have an inclusion of partners, our caregivers. It's important to honor those that support the circle of care, that help us wrap around the community, meaning the circle of care that we wrap around the community. We highlight their work at the end of the year. Um, we want for people to understand the work that they contribute to our organization is important, and we see the work that they do. So this is a way for us to celebrate their contribution to the good work that we're doing in the community.
And can you talk about the significance of the 2023 theme, celebrating self-care? I also think that it's amazing to kind of point this out, as you mentioned, yourself and some of your colleagues, walking out during COVID and taking care of others. Now it's, maybe a time to self-reflect and take care of, yourself. So can you talk about the significance of that?
Well, sometimes people tend to forget about themselves because there is a selfless approach to home care. It's a noble type of work. And sometimes people forget that they need to take care of themselves. So this theme this year is to provide them with tools, is to discuss the importance of self-care, and also the public to know that while we're taking care of our precious patients, we also want our caregivers to understand the importance of taking care of themselves, the staff to understand the importance of taking care of themselves. Mental health is a big theme this year, but we're always in touch with our caregivers, with our integrated system, in terms of the support that's needed, because it takes a village to support the community. So self-care is something that we wanted to highlight this year, because we feel that there is a need for people to understand how to, and also communicate their needs, because sometimes, like I said, we do have our home care workers that, you know, taking care of their clients is their priority, but we also want to highlight the importance of taking care of themselves.
Now, I want to talk about technology a little bit. Your organization has embraced technology in the face of ongoing challenges. Can you share some examples of how technology has been leveraged to streamline operations, enhance patient care, and just improve the overall experience?
I think in home care, we tend to be bogged down with a lot of paperwork, especially for an organization our size, which is very regulated. So using technology help our nurses to be more efficient. They're able to use tablets when they conduct their nursing visits. They reduce the time of having to fill out documents where they can actually do it while in the home. Communication can be sent from their tablet to our case management department or to our QA department. So technology has helped reduce errors. Technology also has helped us to streamline actions by our nursing department to respond quickly. So that has been very effective. So also having partners, collaborating with partners also has helped reduce certain acute situation that may cause our clients to be hospitalized. So we've been able to utilize technology to help us communicate with our clients to address any chronic situations that may have, just to mitigate the need to have them hospitalized. So technology now is playing a huge part, not AI, but more so, but more so better tools that help us streamline communication, respond much quicker than we used to before.
And I like that you mentioned not AI. I know that's a scary thing for a lot of people, but your organization does rely heavily on a dedicated workforce. Could you elaborate on the importance of highly trained and a committed workforce in delivering quality healthcare services to the community?
Um, Longevity is power, and retention of home care workers at CABS has been its biggest assets. So it has helped us to have well trained home care workers who understand this work. So we're constantly doing training. We're constantly, improving the type of programs that we provide, just aligning other types of program. Again, creating a circle of care around the client. And if I go client and members, is because of different programs and also patients, but it does help for us to identify any gaps in their social needs, in their home care needs. And the home care worker is also part of the interdisciplinary team that we use to ensure that the client is not detached to what is needed from us. So the network provide the necessary services or support services to keep them at home.
And how does your organization involve caregivers, patients, and other stakeholders in providing feedback and ensuring continuous service improvement? And I also want to know, is there also an opportunity possibly for family members to be involved? Like, how do you make it feel very much like a community?
That's a good question. Um, we have members of the community who's part of our continuous quality improvement program, where we get to discuss the quality of the care that we're providing from a statistical standpoint. We're able to review the data of the care delivery. So we have a way of capturing that. So we have the involvement of the community who participate in that kind of review process to provide us with feedback, including the home care workers, because this is also a way for us to know what's happening outside in the field because we're not there. So they are our eyes and ears, and we want their feedback. So continuous improvement is something that is ongoing because it's important for us to enhance the service. The client or the patient experience is very important because we want for them to understand the type of service that they provide, what's needed for them to stay in their home longer, happy and safe. So it's important to discuss, all of the elements that would make a successful service for them.
Now, I think now more than ever, at least for me and maybe other people who's learning more about, just the world of healthcare, we talk so much about, the injustices that so many communities face. And I think it's so important that organizations, like yours is doing the work to make sure that we kind of close those gaps. In the context of healthcare, what does social justice means? What does social justice mean to the CABS healthcare network?
It's health equity. Everyone should be able to receive quality care, and we do not deviate from that. The assessment that we provide is tailored, and no one should be deprived of the type of service that they receive, no matter what walks of life they come from. So the service for us and how we provide it has a human touch to it. Although there are challenges that we face as an organization because we are a not for profit, but surrounding the patient with the type of network of services, then they will not have any issues to either maintain their health, receive the type of trained aids that they need to receive to take care of them. So there's no deviation from us. It's part of our DNA.
Now, looking ahead, what are the future plans and aspirations for CABS Healthcare Network, and how does the organization envision its role in promoting the well-being of the community in years to come?
We're always innovative. We stay ahead of new research, understanding the challenges that we as a not for profit will face because we're funded. It's important for the community to know how important the work that we do is important for not only the population that I just mentioned, but I think for the decision makers in our community, sometimes they wait until there is a crisis for them to figure out how to obtain information about, what's in the community. So for us, remaining innovative, be a beacon of light for the underserved population. They need to know that we're here. We want for the public to understand that, um, you know, what we do on a daily basis is something that should be known. Um, we are one of many, but we're quite different with the way we approach the service. So invite us to come to you, invite us to come to your congregation, invite us to come to your tenant association so we can discuss the service that we provide and see how we can be of service to you because we're here to serve you.
Now, that kind of leads into my next question. If an individual is watching, or maybe an organization is watching, and they want to collab or partner up, or just become part of the organization, how can they do that? And are there any requirements to do so?
No, I think to understand who we are as an organization, we have a deep uh, history in Brooklyn, and just accessing our website, and also join us at our Circle of Care Awards on October 12th, which is at 6:30 at Giondo on the Water. And just for this particular type of celebration, they could access the website to get tickets. It's open to the public. They can join us with some of the activities that we do in the community if they want to support that. Also, to be available for the ones who are interested in obtaining services for their family members. They can always access our website or call us. Um, if you want me to give you the
Yes.
telephone number, I can. Okay, so they can call 718-388-0220, and I think I have some information in terms of how they can access us. They can uh, access our website, www.cabshealthnetwork.org. We're on Twitter, Facebook, Instagram, LinkedIn with the same tag at CABS Home Care. Follow us.
All right. Well, I want to thank you so much for taking the time to speak with me and just kind of share what your organization is doing. I think it's very important and more people should know about it. So once again, thank you so much.
You're welcome. Thank you for having me.
We have to take a quick break. We'll be back right after this.